Welcome to Diagnostic Imaging's Weekly Scan. I'm Whitney Palmer, Senior Editor. We are back with you this week to discuss the latest news around the COVID-19 pandemic and its effect on the radiology industry. Existing guidance from the American College of Radiology, released at the beginning of the pandemic, has already cautioned providers and referring clinicians against using chest CT scans for identifying patients who are positive for COVID-19 infection. Research published this week in the American Journal of Radiology underscored that recommendation. In a study from Icahn School of Medicine at Mount Sinai, investigators examined chest CT scans from 30 children between the ages of 10 months and 18 years, who were treated at 6 hospitals in China from mid-January to early February of this year. Based on their analysis, the team determined that 77% of chest CT scans conducted on pediatric patients positive for the virus showed up as negative for antiviral findings, and follow-up imaging showed no change in the scans. Among the 7 patients with positive chest CT scans, 6 had ground glass opacities, and 1 had both ground glass opacities and consolidation. In addition, lower lobes were most commonly involved. Ultimately, the team explained, the low sensitivity of the chest CT scans, coupled with the fact that these findings are not specific for COVID-19 infection, should make radiologists and other providers pause before ordering the exam. Throughout the pandemic, advice and guidance on how to best protect and disinfect CT scanners, X-ray machines, and ultrasound probes has circulated throughout the industry. But there are also steps that MRI suites can take to maximize decontamination efforts and safety measures to protect both patients and staff. Alongside the recommended 6 to 12 hourly air changes, researchers from the University of Southern California Keck School of Medicine and the University of California at Los Angeles David Geffen School of Medicine recommended in a Journal of the American College of Radiology article 6 additional steps for the MRI suite. Wipe down the bay and patient contact surfaces with approved disinfectant wipes after every patient. Add another 1 hour of downtime after scanning patients with suspected or confirmed COVID-19 infection. Close all MRI waiting areas to decrease the risk of airborne viral transmission. Have all staff adhere to personal protective equipment, PPE, protocols at all times. Replace PPE after scanning patients with suspected or confirmed COVID-19 infection. And be sure that all PPE that will be used in the magnet room is MRI safe. This might sound a little strange, but a plastic bag could prove highly effective in reducing the risk of COVID-19 transmission in patients who undergo chest CT scans. Investigators from the National Institutes of Health unveiled their prototype for a patient isolation bag in academic radiology. This hypoallergenic plastic polymer bag is made from the same material that protects ultrasound transducers, CT gantries, and image detectors. Staff help patients put the suit on by rolling it down from their head, and the bag seals around the patient's head and chest with either an elastic band or a disposable Velcro belt. The patient breathes air through an air intake nozzle that has a nasal cannula for patients who need additional oxygen. And according to researchers, the bag could reduce the 2-hour decontamination and ventilation time required, increasing the number of patients scanned daily from 10 to 144. Early estimates of how COVID-19 would impact imaging volumes predicted that practices, departments, and imaging centers would see up to a 70% drop in the number of scans requested. New research from Northwell Health and the Neiman Health Policy Institute, published this week in the Journal of the American College of Radiology, however, revealed that while the amount isn't quite that large, the dip in volume is still significant. Based on a review of the same 16-week period from 2019 to 2020, investigators determined the industry has seen an overall 28% decline in total imaging volume. For the same time period, radiologists conducted 522,645 scans in 2019, compared to 458,438 in 2020. More specifically, the data showed a nearly 55% drop in emergency room imaging volumes, a 37% decline in inpatient imaging, and a nearly 88% reduction in imaging in the outpatient setting. The biggest decline was seen in mammography, followed by nuclear medicine, MRI, ultrasound, interventional radiology, CT, and X-ray. And finally, this week, there has been news looking at the impact of the COVID-19 pandemic on female radiologists and how their experiences have differed from their male counterparts. The challenges can be both professional and personal, spanning from having less time to publish academic articles to needing to devote energies to caring for loved ones. To discuss these differences and what they mean for providers in the industry overall, Diagnostic Imaging spoke with Dr. Geraldine McGinty, president of the American College of Radiology. She discussed what the industry has seen develop as this pandemic has continued. Here's what she had to say. Welcome to Diagnostic Imaging. I'm Whitney Palmer, senior editor. For more than 2 months, radiology as a whole has been impacted in a variety of ways by the COVID-19 pandemic. It is an outbreak that has touched every hospital department, every practice, and every imaging center. But it's safe to say that not every radiologist has experienced this situation in the same way. We are joined today by Dr. Geraldine McGinty, president of the American College of Radiology, to discuss how this pandemic has affected female radiologists differently than their male counterparts. What challenges have they faced, and how have they been impacted by those challenges? In what ways are female radiologists perhaps uniquely suited to assume greater leadership roles during this time? And what lessons can the industry learn from this experience about gender equality in the specialty? Thank you for joining us today, Dr. McGinty. We're delighted to have the opportunity to talk with you.
Thank you for having me, Whitney.
Wonderful. Well, if you could, walk us through the professional challenges that female radiologists have faced during the pandemic.
Honestly, I think those professional challenges really cross all genders. Figuring out how to manage working from home, possibly for the first time, figuring out the challenges of childcare, and if you have an administrative role, navigating all of those Zoom calls. And then also, trying to maintain, especially if you have an academic career, trying to maintain all of that other work that was fitted around your clinical practice.
All right, so then specifically, I guess, let us know the impact that those challenges have had and how they have touched on the female radiologist's ability to practice at a high level right now.
Well, I do want to first of all acknowledge that there are definitely radiologists who are at the front lines. I've been so humbled to see actually in many cases our trainees being redeployed and pulling out their clinical skills to deliver care in the ICU. So let's just be clear that radiologists have been contributing in many ways, but let's talk about the more routine clinical practice. And I think that first of all, as I say, getting set up from home and trying just to navigate the demands of the day between figuring out homeschooling and if you have a significant other at home who's also trying to work from home. But I think there's definitely data. Let's focus on some of the areas where we have data where there may be a real impact. And I think one of the things we are seeing, and you may have noticed the Nature article that talks about the fact that women are uploading fewer articles to preprint servers, and there's a sense that their research is taking a second place to all of the other things that they're trying to get done. So that's one thing I think we're going to want to be really aware of. I know my own institution has sort of stopped the tenure clock for some time, and I'd like to make sure that we're not going to disadvantage women as we come out of this pandemic because of perhaps having had to put other responsibilities first.
All right. Well, you mentioned some of the literature. There was also a study that came out looking at the differences in how female and male radiologists are handling video conferencing. What are some of the issues that have kind of bubbled up in looking at that particular situation?
I've read a lot of that research too, and there's no doubt that we women are sometimes harder on ourselves. We're worried about how perhaps we look on the video conferencing, and you can see that I have a virtual background, so that just make sure I don't have to think about what's behind me. But I think at this point we've all adapted. I think having your kid or your pet join your video call is pretty much normal now. I will say in my own department, we've been doing twice a week video calls with our chair. And, the goal has been for everyone to have a chance to talk about what this means to them, talk about how they're coping. And I think it's really important that we acknowledge that this is not perfect, this is not normal, and we have to cut ourselves some slack and be kind to each other.
All right. Well, we've talked a great deal about the professional challenges. What about some of the personal ones? You touched on it with childcare and significant others and parents. How are women necessarily feeling this differently than male counterparts?
I don't know that I can really speak to that in a particularly informed way. There's certainly been, you've seen news articles out there about how male parents think that they're doing great with helping with the education. Their female partners don't necessarily agree. I'm not a mom, so I'm not going to weigh in on that. But what I will say is that I've seen a huge amount of connection and solidarity among our entire radiology community, but certainly a lot of programming from our Radiology Leadership Institute, from the AAWR, to help us support each other through this time, help us make sure that we protect time to exercise, time for self-care.
All right. Well, then going down that road just a little bit more, talking about strategies and actions that maybe we can implement to help each other during this time. What are some of those things that the industry as a whole perhaps can do to help both female and male radiologists at this time kind of rise to the top of their abilities?
Well, I think it really does start at the top. It starts at the organizational level. And I think that for an organization like the ACR to really commit to wellness as a key strategic initiative and make sure that we have programming and tools out there, that's really important, because that says that as a community, we've decided this is worth our investment of our time and resources. And then I think it becomes, if we take it all the way to the individual level, it's about checking in on each other and just a quick note that says, how are you doing? Is there anything I can help you with? But also, for some of us who aren't necessarily as burdened as others with things like childcare, it's about taking the opportunity to reach out to, say, a med student who's interested in radiology, who's been furloughed or sent home, to say, is there a project you'd like to help me with? So that we can actually keep connections going, build connections, and not lose so much momentum during this time.
All right. So even though there are a myriad of challenges, and you started to touch on this, are there ways in which female radiologists can take this opportunity to assume greater leadership roles within their own institutions or exert more influence?
I think that in my ACR report to the council, I talked about, I was very impacted by an interview that I read with Rabbi Jonathan Sachs. And he said that each of us has to say to ourselves, what does this crisis ask of me? And I think that, really thinking about how we can contribute, and whether that's being on the front lines in the ICU, doing things that you're not necessarily comfortable with, whether it's checking in with colleagues, whether it's finding the time to actually write about the experience. Our impact can be very, very varied, but I think each of us has to think about what we can do. Now, that said, I think you have to be very aware that, with working remotely, this Zoom call format that's not perfect, this can really impact imposter syndrome, and it can actually, I think, compound that and make it feel worse. I'm not in the department. I'm not being seen at meetings. I'm struggling to manage all my responsibilities. So again, I think as a community, we have to be caring. We have to, realize that I hope this is temporary. That this is not normal, and not worry too much if, we haven't, made a major contribution as we see it in the short term.
All right. Well, then looking into the post-COVID environment, then what are some of the lessons that this experience has taught the industry about, making sure that there is that equal opportunity and chance for female radiologists to, again, contribute to the highest level?
I think many practices made a significant shift to home reading much more quickly than they thought that they ever could, and much more comprehensively than they thought they ever could. Now, I think a lot of us miss the interaction. I've still been doing some clinical work, and I absolutely love my day on campus. So I think, but I think realizing that we can be much more individual in terms of how do you like to work? How can we accommodate your life and make sure that you're a successful radiologist at the same time? So I think finding that ability to be more nuanced as opposed to a one size fits all is something that we've all learned.
All right. Well, I appreciate this, kind of stepping back to that 50,000 foot level, thinking from an anecdotal perspective or a data-driven perspective. Is there anything else that the community needs to know about how this pandemic is affecting radiologists in different ways that we should really point out?
Yeah, I mean, I think that there are some clear challenges for our radiology community. I mean, having made the very appropriate decision to pull back on essentially on non-essential imaging, we're going to see practices really struggling financially, especially those practices in small and rural areas who are not only significant caregivers in their communities, but also significant employers. So, this is going to be a challenge. And I think we all worry at this point about delaying, life-saving screening exams much longer. So I think we're all struggling to think about how we can get back to normal as quickly as possible, but as safely as possible. So I'm very proud of the guidance that the ACR has provided there. But I think to recognize the value of imaging, it's important that we recognize that the imaging that we were doing was valuable and will remain valuable. So we have to make sure that we preserve that access for our patients.
All right. Well, Dr. McGinty, thank you so much for taking the time to talk with us today. I greatly appreciate it.
Thank you very much for having me.